Namaskaram to all. A very warm welcome to 29th Parva of Prabodhini webinar series. So we have our guest speaker arrived and the whole team is ready for a mind-blowing session by him. So before starting the scientific session, let us seek the blessings of Lord Dhanvantari and we will start with Dhanvantari Vandana.
लोके जरारुक भयमृत्युनाशम् दादारमीशं विविधौषधीनां धन्वन्तरिं रमानाथं सर्वरोगनिवारकम् प्रवर्तारम् वन्दे पीयूषदायकम् सर्वे जना सुखिनो भवन्तु सर्वे सन्तु निरामया शांति शांति शांति
Om Dhanvantare Namaha. So with all the blessings of Lord Dhanvantari, let's start today's mind-blowing session of the principles and practice of Rukshana in Panchakarma treatment or in Ayurveda treatment. And our guest speaker is Dr.Dibyajyoti Moharana. So before starting the scientific session, let me just revise the rules and regulations of Prabodhini, and it will take just 5 minutes. So let me start the presentation. So we have arrived the 29th Parva of Prabodhini webinar series. And our today's guest speaker is Dr. Dibyajyoti Moharana, Assistant Professor, Department of Panchakarma. His detailed intro will be given by Dr. Sheenas. But let me just tell you that Prabodhini webinar series is organized by Shri Babu Singh Jai Singh, PG Ayurvedic Medical College and Hospital, Farrukhabad, UP. And we all know that Ayurveda is the gift of ancient sages, and it is written in the form of Ayurveda shlokas, in the form of Sanskrit secrets, formulations, and we need a guide to decode them. We need a guide to make them understand. We need a path enlightener who can give his knowledge and help us to learn so many things which are hidden in Ayurveda texts. So our patrons, Dr. Shailendra Yadav, Chairman JS Group, our Director Ma'am, Dr. Sunita Yadav, JS Group, and our Principal Sir, Dr. Manjunath NS, from Shri Babu Singh Jai Singh, PG Ayurvedic Medical College and Hospital, Farrukhabad, provided us this platform, Prabodhini, to bring these kinds of speakers, guides, to collect the gems from Ayurveda who can guide you all people to find the right path. We, the organizers of Prabodhini webinar series, Dr. Niharanjan Mahanta, Associate Professor from Panchakarma, SSN Ayurvedic College and Research Institute, Dr. Preetimai Sahu, myself, Associate Professor Kaichikisa from Sri Sri Ayurveda College of Ayurvedic Science and Research Hospital, Sri Sri University, and Dr. Seenas BS, Assistant Professor Panchakarma from Sri Babu Singh Jai Singh Ayurvedic Medical College and Hospital, Farrukhabad. So in our path, we started this in April 2023, and we found so many talented speakers. We had so many path enlighteners who accompanied us, who shared their knowledge in this platform and helped many people to find the right way. And today we have reached Parva 29. Which topic is principles and practice of Rukshana, which we are going to discuss today. But before that let's just revise the rules and regulations. Registration is mandatory. Registration is done through filling the Zoom forms provided in the link. After filling in the Zoom forms, you have to join the WhatsApp group Prabodhini through the link provided, as all the further proceedings will be intimated in the group. So please don't leave the group, because we sometimes find some people leave the group, but the next Prabodhini webinar information will be given in that group only. On successful submission of the form, you will get a confirmation mail containing Zoom meeting joining link. Please join the webinar with the link provided, as it is individualized and separate for all. If you are not joining from the provided link, if you are using some other link to join, then our attendance think will it will be difficult to mark your attendance in this webinar. So your name and email ID in the Zoom form should be correct, as it will be used in your e-certificate. So please be very careful while filling up the Zoom forms. Your email ID should be correct and your name should be correct, because your certificate is going to carry that name which you have provided in the Zoom form. So e-certificates will be provided to all the participants attending the webinar more than 45 minutes. Attendance is a must. We will check with the attendance. Our system is recording everything. Your attendance will also be recorded in that, and after the attendance checking, our team will report us, and after that only we will be providing the e-certificate. So minimum 45 minutes attendance is compulsory for all. You will get your e-certificates through email ID registered with us within 7 days, and thus there is no need to share your email IDs during the webinar sessions. Please try to extract the maximum out of our guest speakers, because it is the chance when you get these talented people on this platform, and you should utilize your maximum time to gain whatever you can from them. So, with this note, I will end this introductory session, and I will hand over this session to Dr. Sheena's BS Assistant Professor from Department of Panchakarma. He will introduce our guest speaker and take the scientific session forward. So, thank you everyone. Hand over to Dr. Sheenas.
Thank you so much, ma'am. Om Shri Dhanvantare Namah. Om Shri Gurubhyo Namah. With the great blessings of Dhanvantari and our all gurus, actually, ma'am already explained detailedly about the Prabodhini journey. So that we are starting from that 23 onwards to now, we are make a very good flow of knowledge, sharing of knowledge, that pracharana we are doing in the word of Ayurveda. So we are hoping that to continue the same. So for that, actually, I am giving much more thankful to Dr. Pridhimai Sau ma'am and also Dr. Niharanjan sir. Actually, they are giving much more support for this journey from the starting. After going from this institution, also that support that आयुर्वेद का प्रचरण करने के लिए, एक्चुअली हम अलग इंस्टीट्यूशन है तो भी हम आयुर्वेद का प्रचरण है हमारा सारे का एक मोटो. सो इसके लिए वो ज्यादा सपोर्ट करते हैं. Actually, that's I will give a much thankful to them, and also that I will go to directly to our today's speaker, and Dr.Dibyajyoti Moharana, actually Assistant Professor from Department of Panchakarma, Sri Sri College of Ayurvedic Science and Research Hospital, Sri Sri University, Cuttack, Odisha. Actually, sir is dealing that subject, that principle and practice of Rukshana Karma. Actually, while going to discuss about some few words about sir, actually, he has completed his BMS in 2018 and completed his Panchakarma PG in 2022 from Rajiv Gandhi University of Health Science, Bangalore, Karnataka. And now he's continuing his PhD work also in the Panchakarma in Parul University, Vadodara, Gujarat. And he has undergone Sri Sri Tattva Nadi Pariksha training program in the year of 2019 at Art of Living International Center, Bangalore, and is trained Nadi Pariksha consult. He has presented more than 23 scientific oral papers on Panchakarma across the country in different state, national, international level conference, seminars, and webinars, and has published 5 articles in reputed national and international level medical journals. He has undergone more than 35 offline and online certified Ayurveda training programs He is very specialized in the management of musculoskeletal disorders, rheumatic disorders, and neurological conditions. He has published many that articles in different journals, and also got different awards, best paper awards for in more than 10 best paper awards, oral presentation awards he got from his that curriculum, and also he's got some special award, the Rajya Puraskar from award from the Bharat Scout and Guides, and also that Rashtrapati Scout Award that is also got from the President Scout by the national organization Bharat Scout and Guides. So I'm heartfully welcome our Dibyajyoti sir. Actually, currently he is assistant professor in Sri University, that Ayurveda Institute. So heartily welcome to you, sir, to the Prabodhini Parva 2029 episode in organized by Sri Babu Singh Jai Singh Ayurveda Medical College. So hand over to you, sir, to explain the importance of Rukshana and principle and practice of the Rukshana Karma. Hand over to you, sir. Thank you.
Thank you so much, Dr. Sinha sir, for the warm introduction. I just want to thank the organizers of Prabodhini, the dedicated team behind organizing such a sharing beautiful knowledge of Ayurveda to the whole world. So I must thank all the patrons of this Prabodhini, the chairman, the director, the principal, Sri Babu Singh Jai Singh PG Ayurveda Medical College, Farukabad, UP. I also thank the core committee members, Dr. Pritimay Madam, Dr. Nihar sir, Dr. Srinath sir. They are just putting off their ideas, the effort in organizing such a beautiful knowledge session on all the subjects of Ayurveda, including Panchakarma, Kaya Chikitsa, Shalya. I just thank for the opportunity given to me, and thank you so much. So shall I start with my presentation, sir?
Yes, sir. Can start.
Is my voice audible, sir, properly?
Yes, audible.
So is it visible, sir?
Yes, sir. Please put into the full screen mode. Yes. Okay, correct.
So coming to today's topic allotted to me, that is principle and practice of Rukshana Karma. Pink slides are somehow stopped. The slides movement are a bit, it's not moving. I don't know. Yes. So coming to the principle and practice of Rukshana Karma. So Rukshana is one among the most practiced Upakarma, but it is one of the very underrated Upakarma in Panchakarma. So there are a lot of highlighting points. People highlight, the practitioners highlight on Snehana. So there is a trend of Snehana, Svedana, Vamana, Virechana, Basti. But somehow I feel that in the this is the era of Santarpana Janya Vikaras. We come across with different lifestyle disorder, especially we come across the autoimmune disease, especially like SLE, rheumatoid arthritis, Amavata, Vatarakta, and some form of Santarpana Janya Vikara in form of diabetic mellitus, whether it is Stula Pramehi, Krusha Pramehi, or some type of Meda, Mamsa Meda Janya Vikara, especially we come across with dyslipidemia, hyperlipidemia, hypothyroidism, PCOD, PCOS. So I feel that this is the era of Santarpana Janya Vikara. And Rukshana plays a very huge role because if we broadly classify the entire disease, it will either fall in either Santarpana Janya Vikara or Apatarpana Janya Vikara. So disease can be classified under the broad heading of these two, and the treatment is as follows. For the Santarpana Janya Vikara, Chikitsa is Apatarpana, and for the Apatarpana Janya Vikara, the Chikitsa is Santarpana. So Rukshana is one among Apatarpana Chikitsa, so which is indicated in Santarpana Janya Vikara. So Rukshana is a part of Apatarpana Chikitsa. It's part of Apatarpana, and so it is indicated. So it is one, especially it is one among Shadvidhopakramas, and we can do this Rukshana Karma either externally or internally, Bahya and Abhyantara Prayoga. So this Rukshana is indicated in Santarpana Janya Vikara, as I said earlier, metabolic disease, lifestyle disease. And the beautiful part of this Rukshana is it can be administered in many forms. It can be administered in form of ahara. It can be administered in form of bihara also. And it can be administered in form of panchakarma, upakrama, external therapies, internal therapies, in form of diet, in form of drinks, in form of food items. So there are different ways of administering this Rukshana into the lives of the patients. And so a very beautiful definition for a layman purpose. The Rukshana is a drying therapeutics used in Panchakarma in order to it is Kaphagna, Medagna, Amagna. So this Upakrama is specially meant to reduce Kapha, Meda, Ama, and excessive snigdhata of the body. And it is mainly employed before Snehana. So it forms a Purva Karma also. So this if the patient is Mamsala, Medra, Hurishleshma, then this Rukshana forms Purva Karma. And it also can be a independent therapy in special disorders, especially like Amavata, especially like Staulia, Vatrakta, Urustamba. So standalone treatment. Rukshana can be a standalone treatment, and in the patient of Mamsala, Medra, Hurishleshma, Rukshana becomes Purva Karma. So this is the beauty of Rukshana. And this subject of Rukshana is quite underrated, not practiced, not much discussed topic, and that is the importance what it holds to the present era, that has the importance and lot of diseases related to lifestyle. So Rukshana and some of its specifications: Swarupa, Sneha Bhava, Shoshane Shakti, Nirukti, Raukshata, Kharata, Vaishadyata. Pradhana Mahabhuta, Vayu Agni Akasha Mahabhuta. Rasa Pradhana, Kashaya Katu Tikta Rasa Pradhana, Guna Pradhana, Ruksha, Laghu, Khara, Tikshna, Ushna, Sthira, Apicchila, Kathina. Prayoga, as I already explained, it can be Bahya Abhyantara or in form of Ahara, Bihara, Aushadha or Upakrama. Karma, so the action of Rukshana, what action it produces on the body, especially Kapha Shamana, Kapha Medahara, Shoshana, Lekhana, Shodhana, Srota Shodhaka, Amapachana. So these are some of the special karmas that Rukshana performs on the body. So Rukshana Arha, indications of Rukshana: Srota Rodha, Prachura Dosha, Gurishleshma, Kleda, Avishan. So these are some of the special conditions that Rukshana is indicated. And Rukshana Anhara, a contraindication of Rukshana, especially Ruksha Purusha, because again, if we start giving Rukshana in contraindicated person of Rukshana, then there will be excess Vata Prakopa. Excess Vata Prakopa will happen. So these are some of the conditions where Rukshana is completely contraindicated. What are they? They are Ruksha Purusha, Shina, Krisha, Urdhvavata, Udavarta, Shosha, धातुक्षय, वात व्याधि, especially धातुक्षय जन्य वात व्याधि, गर्भावस्था, balakshaya, वृद्धा, after excessive shodhana, shodhita, the person who has undergone shodhana or who has undergone repeated shodhana, those persons are also contraindicated for rukshana. Vata pradhana kushta, vata jo kushta, which is without ama lakshana. So those conditions, specific condition are contraindicated. Ojakshaya and Kshaya Roga. Kshaya Roga, Ojakshaya, Rajakshma. So all these conditions, these are contraindicated for this Rukshana. So these are some of the specifications. So Rukshana is all about. And coming to the next slide, the Nirukti. So Shoshane Ruksha. So Shoshane Ruksha, Virukshanasya hi Mukhya, Sneha Abhava Sadhya. So very beautifully it is explained that Rukshana is derived from the root word Ruksha, which means dry or absence of Sneha, that is Sneha Bhava. And it does Shoshana. So Shoshana is the Mukhya Karma, and it is dry or absence of Sneha, that is Sneha Bhava, and this special thing it does Shoshana. This is Nirukti. So coming to the next slide. So it is one among, definitely Rukshana is one among Shadvidhopakrama, Langhanam Brahmanam Kale Rukshanam Snehanam Tata Swedanam Stamanam Chaiva Janite Yasa Vevisha. You can see Langhana Brahmana Rukshana Snehana Svedana Stambana. So Rukshana is one among the treatment principle explained by Acharya Charaka, that is Rukshana Karma. So coming to the next slide, Dvivida Upakrama. So Dvivida Upakrama, so again the Ashtanga Hridaya Kara, the Acharya Bhagavata has explained the Dvivida Upakrama. Masya hi Dvivida Upakrama matah ekah Santarpana tatra dutiyascha Apatarpana Brahmano Langanascheti tatriyaya udahutau Brahmanam yad Brahmanatvaya Langanam Laghavaya yat ehasya. So again, so under the group of Santarpana, there is Brahmana, Snehana and Stambana, and the shloka says that the Brahmana is also a paryaya of Santarpana. And under the group of Apatarpana, we have Langhana, Rukshana and Svedana, and the shloka says that the Langhana is also paryaya or synonym to this Apatarpana. And according to Acharya Bhagavata, Rukshana is a type of Langhana. Yes, Langhana dravyas are mainly predominant of Vayu, Agni and Akash Mahabhuta. So these are some of the fundamentals or basics that Rukshana stands on. So coming to the Ruksha Dravya Panchabhautika Sangatana. So Ruksha Dravya Panchabhautika Sangatana. So Ruksha Dravyas are mainly predominant of this Mahabhuta, especially Vayu, Agni and Akasha Mahabhuta. Strongly predominant of this Vayu, Agni, Akasha Mahabhuta, these Ruksha Dravyas. Again, this Prithvi Jala Mahabhuta, the presence of this Prithvi and Jala Mutra is very negligible, very less. So coming to the definition of the Rukshana. So definition or paribhasa of Rukshana, it is very beautifully highlighted in Charaka Sutrasthana 22nd chapter. Roksham Kharatvam Vaishadyam Yat Kurya Tadhi Rukshanam. Roksham Mityadau Roksham Meva Pradhana Bodha Dravyam Kharatva Vaishadyate Tu Tad Anugate. The process, any process or drug or any factor or any cause or any procedure that brings about Rokshata, Kharata and Vaishadyata in the Sharira or in the body is termed as Rukshana. And there is one dependent attribute, that is independent attribute and two dependent attributes. So the primary attribute or the principal or the dominating attribute is Rokshata. So there must be, to induce this Rukshana, the Dravya must do this Rukshata to the body. So this is an independent attribute, that is primary, and there are two coordinating secondary attributes, that is Kharata and Vaishadyata. So Rukshata refers to roughness, harshness, dryness, whereas this Kharata refers to this roughness, hardness, dry or any rough texture, feel of a dry or rough texture, coarseness. So these are some of the attribute, both Kharata and Vaishyadhyata are non-independent or secondary attribute or character or feature. Coming to the Vaishyadhyata, it refers to clarity, clearness, smoothness, non-unctuousness in Ayurveda terminology, especially in this shloka. It is a property often associated with dryness and roughness, but emphasizes a lack of smoothness or oiliness in the tissue. So this is the main criteria of something to induce Rukshana in the body. So these are the three main things. The three, one is primary, one is independent, and one is independent attribute and two are dependent attribute, Raukshata, Kharata and Vaishyadhyata. So Rauksham, Kharatam, Vaishyadhyam, Yat Kuryat, Ati Rukshana. So this is the paribhasa or the definition of Rukshana. So coming to again, there is another form of definition we can make out the same chapter. Katu tikta kashanam sevanam strishu asamyam khali pinyaka takranam madhudinam cha rukshanam. So it comes with some certain nidana that the shloka tells about certain type of factor, certain type of etiopathology, so etiology or some type of cause that leads to this rukshana. It is atishevana or excessive intake of this katu tikta kashaya rasahara, regular or habitual or excessive use of intake of katu tikta kashaya rasa induces rukshana. So again, uncontrolled or excessive sexual intercourse, that also ativyavaya induces this rukshana, leads to vata prakopa, and obviously it will lead to rukshana. And some of the food items, especially khalli, pinyaka, takra and madhu. So khalli again, it is a oil cake prepared out of sarshapa. Pinyaka again, the oil cake prepared out of this tila. Takra buttermilk and madhu. This honey are ruksha dravyas or having this rukshana property that induces rukshana in the sharira. Ruksha dravyas that induces some of the food items classically mentioned which induces rukshata in the sharira. So coming to some of the gunas of rukshana, ruksham laghu kharam tikshnam ushnam sthiram pichilam Apicchilam. So ruksham, laghu, kharam, tikshnam, ushnam, sthiram, apicchilam, praya, kathina, chaiva, yad dravya, tadhi rukshanam. So these are some of the gunas mentioned by Acharya Charaka. So rukshana is mainly achieved by sneha bhava. It is ruksha guna pradhana karma. The general properties or attributes are ruksha, laghu, khara, tikshna, ushna, sthira, apicchila, kathina. Again, we have the reference of Ashtangridaya, very beautifully told. Grushita, Sarasnigdha, Manda Shukshma, Mrududravam, Aushadam, Snehanam Prayo, Viparitam Virukshanam. So he tells about the Snehana Guna, the Ashtangridaya Kara, the Sutrasthana Bhagavata, initially mentions about the Sneha Gunas and just right there that Viparitam Virukshanam. So opposite of all these gunas are the gunas or attributes that Rukshana belong to. Again, the commentator Anuradha, so he just clarifies that those are thus Laghu, Ushna, Sthira, Ruksha, Tikshna, Stula, Kathina and Chandra. So these are some of the gunas of Rukshana according to Ashtanga Kara. So indications of Rukshana, Abhishanna, Mahadosha. So coming to the indication, so where and all we can apply this Rukshana. So Abhishanna, Mahadosha, Marmastha Vyadhyaschaye, Urustamba Pravruttayo, Rukshaniya Nidarsita. So Abhishanna, Mahadosha, Marmastha Vyadhyaschaye, Urustamba Pravruttayo, Rukshaniya Nidarsita. So this speak about some of the specific indications. Abhishanna relates to some of the obstructive pathology or something like dava pradhana shleshma vikara like prameha, or any obstruction of the body channels, obstruction of srotavarodha, which is caused due to excessive discharge. So these are some of the correlations we do with this Abhishanna. Mahadosha, again, Mahadoshakara, everybody would have known Mahadoshakara bhavas. So Mahadoshakara bhavas, again the disease like Prameha, Kushta, these directly come under the Mahadoshakara bhavas. Kapha Vriddhi Avastha, Bahudosha Avastha. Okay, so the disease with greater morbidity, so greater fatality. So such type of disease come under Mahadosha Avastha, where all the three doshas have involved in the disease. Marmastha Vyadhi, disease affecting Marma Pradesha. Again, the disease of vital organs, the disease of vital points in the body. Marmastha Vyadhi, Marmastha Sandhi Vyadhis. Again, the Urustamba, it's a special type of disorders where all Panchakarmas are contraindicated. But then there comes a Upakrama like Rukshana. This is directly indicated in Urustamba. And I have just mentioned some of the very uh, the present disease where Rukshana is practiced by our doctors. The Ayurveda Vaidyas practicing Rukshana in some of very highlighting diseases, especially in Ama Pradhan Avastha, Ama dominant diseases, especially Ama Vata, or any disease where you find Ama Lakshana can be considered under this heading that is Ama dominant disease. Kapha Meda Vikaras. Yes, so people with such intake of so much calories of diet, diabetic patient, patient with hypothyroidism, dyslipidemia, Meda Vikara, Mamsa Vikara. So this Kapha Meda Vikara becomes a lifestyle disorder or metabolic disorder where this Rukshana is directly indicated, and this is also a very uh, disease where this Rukshana is practiced widely. Amavata, Stolya, Prameha, that is Stula Pramehi, especially Stula Pramehi has to be considered here. Sandhigatavata with Amalakshana, Kapha Pradhana Kuchta, Kapha Pradhana Kuchta, Kushtaroga. So all these are some of the condition where Rukshana is widely practiced. So these are some of the indications of Rukshana. And coming to the next slide. So how many days we have to do Rukshana? So whether it is 1 day, 2 days, some people does it for 7 days, 3 days, 5 days, 10 days, 1 month. So basically the question is very wide open, and so there is the every patient is different. Purusham bhiksha. So there is not a certain boundary that we can fix, and we have to see the dosha lakshana, ama lakshana. We have to see the dosha avastha, roga avastha, rogya avastha. We have to see the background of the disease. We have to do the pariksha, dashavida pariksha, dvadasha pariksha we have to do. And rukshana has to be done till the attainment of niram avastha. So if we find any amavastha in the disease, and that to be done, the rukshana has to be continued till the attainment of nirama lakshanas, or it has to be done till the attainment of samyak ruksha lakshana. Samyak ruksha lakshana. So until the attainment of samyak ruksha lakshana, we have to continue the rukshana. And also there is a reference of Jirnahara Lakshana. So Rukshana is also continued till the attainment of this Jirnahara Lakshana, where whether you are giving it Abhyantara Rukshana or Bahya Rukshana. So we should always check this Samyak Ruksha Lakshana or Jirnahara Lakshana or this Nirama Lakshanas. So those things has to be highlighted when there will be the days decision that comes to every patient. Some patient might take 3 days to undergo complete rukshana. Samyak ruksha lakshana might take only 3 days. Some patient we do udvartana for 3 days, 7 days. So for every patient that has to be clinically checked whether the patient is attaining those ruksha lakshanas or not, or whether there is jirnahara lakshanas or whether there is nirama lakshanas. So again, coming to Samyak Ruksha Lakshanas, Vata Mutra Purishana, Visharga Gatra Lagave, Hruday Udgara, Kanthasya Suddhau, Tandraklame Gate, Sweda Jate Rucho Chaiva, Chut Pipasa Sahodaye, Kritam Langhanam Adesham, Nirvyarthe Chantratmani. So he beautifully tells about this Samyak Ruksha Lakshana, that is Vata Mutra Purisha. So again, Samyak Nirharana, Samyak Nirharana of Vata, Mutra, Mala Pravritti. So proper excretion of flatus, urine and feces. Gatra Laguta, Sharira Laguta, Hridaya Suddhi. Yes, again the feeling of this clarity or purity in the heart, cardiac reason. Udgara Suddhi, Kantha Suddhi, asya suddhi, and tandranasha, klamanasha. So sweda pradurbhava, that is appearance of the sweat. Ruchi, again the so appreciating the taste of the food, the desire for having food. Chud pipasa sahodaye, feeling of hunger or thirst. So nirvyarthe antaratmani. So nirvyarthe antaratmana means the inner feeling or the sense of satisfaction, the sense of contentment. So that is the feeling of the well-being that comes from inside with this Samyak Ruksha Lakshana. So once the Samyak Ruksha Lakshana is attended properly, so we must stop with Rukshana and we must decide whether the patient needs this Snehana Upakrama, the Snehana Chikitsa. So whether it is Abhyanga or any type of Patrapinda Sveda or Snigdha Pinda Sveda, so that has to be continued further. So initial treatment is made with Rukshana, then according to the disease condition, and it should be carried forward by the Snigdha Chikitsa or Sneha Chikitsa. So that should be Avastha Anusara Chikitsa has to be maintained in the line of treatment of any disease. So Avastha Anusara Chikitsa. So coming to the next slide, Rukshana Atiyoga. So again, if we start giving Rukshana without any examining the patient, for example, continuously 7 days, 8 days, 10 days, then the person also practically speaking, any Sandhigata Vata, whether it is Amavata, if Sandhigata Vata with Ama Lakshana or whether it is Amavata, if we do excessive Lukshana, then patient tells that, sir, I am feeling weak, I am feeling tired, I am having the pain, the disease is increasing, the pain is increasing, I am not able to stand properly. So these are some of the casual questions that patient ask. If we just exceeds the Samyak Lakshanas of this Rukshana, then the person land of it's in Atiyoga Lakshana of Rukshana. So what are they? The Atiyoga Lakshanas of Rukshana. So Parvaveda Angamardascha Kasa Socha Mukhasya cha. So Shut Pranasho Aruchi Trishna Dorvalye Sotra Netrayo Mana Sambramo Avishnam Urdhvavata Stamo Hruti Deha Agni Balanasascha Langhane Atikrite Bhavet. So some of the Atiyoga Lakshanas are like Parva Bheda, pain in the joints, Angamarta, Asa, Mukha Shosha, Shut Pranasha, Aruchi, Trishna, Shrotra Netra Dorvalya. So Shrotra, again the weakness of hearing and the weakness in the vision. Manasambrama, that is Manasthirata. Manasthirata means altered state of mind. So not able to concentrate properly, that is mental confusion. Urdhvavata, it can be also Udavarta life of Lakshana, you can see Urdhvavata, excessive upward movement of Vayu, Tamo Hrudi, feeling of darkness, Tamo Guna Pradhana, so everything feels like darkness, discomfort. Deha Valanasa. So Deha Valanasa again, Dehanasa Valanasa, weakness, loss of weight, loss of strength, Agni Nasa. So again, this Jatra Agni, again we can consider all the Agnis, Sapta Dhatva Agni. So Agni Nasa becomes whenever there is excessive Vata Prakopa or Ati Rukshata. When Ati Rukshata takes over, so these are some of the symptoms seen in the patients. So we should always stop our chikitsa. So we should always stop our this Rukshana Chikitsa whenever the patient has attended Samyak Ruksha Lakshana or Ahara Jirna Lakshanas, or it can be Nirama Lakshanas. If there is Ama Lakshana, then we should stop whenever the Nirama Lakshana is attended. We should not give this excess of treatment and we should not make the patient to land off in Rukshana Atiyoga. So that has to be kept in the mind. So coming to the relevance of Panchakarma in this Rukshana context. So what is the relevance of Panchakarma? So Rukshana Prayoga in Panchakarma. So how we induce Rukshana in form of any karmas, any Panchakarmas. So coming to the Purva karmas like Ruksha Purva Snehapana. So Ruksha Purvaka Snehapana. Ruksha Purvaka Snehapana means, so there are certain condition the patient has, especially like Mamsala, Medura, Bhurishleshma, Vishamagni, such are some of the condition where patient have to undergo Rukshana before administering Snehapana. So before administration of Snehapana, this category of patients should undergo Rukshana Chikitsa. Then there are different Ruksha Sweda, Ruksha Virechana, Ruksha Vasti, Ruksha or Karshana Nasya, and there are some other Upakramas like Udvartanam, Utsadanam, Udgharshanam, Ruksha Lepa Chikitsa, Kavala Gandusha with Ruksha Ushadis, Dhumapana with Tikshna and Ruksha Ushadis. Again, there are some of the treatment like Baluka Pinda Sweda, Churna Pinda Sweda, Dhanyamla Dhara, Agni Chikitsa Lepa. So there are some of very beautiful treatment protocols. Those are prepared especially to deal with this Rukshana Chikitsa or especially designed to deal with any type of Santarpana Janya Vikara we come across. So coming to details, what are the methods and techniques of Rukshana? So the method of administration of Rukshana in the body can be done in two forms, can be done in two methods. One is internal, another one is external. So Abhyantara Rukshana, another one is Bahya Rukshana. Very simple. It is not complicated like any other treatments. A very simplified version of Rukshana. It has to be practiced in these two forms. Internal method, external method. Abhyantara Rukshana, Bahya Rukshana. So coming to these internal methods for Abhyantara Rukshana, so there are certain type of diets that induces Rukshana. Diet or Ahara, especially like regular intake of Kashaya, Kattu, Piktarasa, Khalli, again the cake of mustard or Sasapa, Pinyaka, Takra, buttermilk, Madhu, honey, Khalla is a preparation from curd. So Udalaka, Shamaka, Kodrava, Yava, Rukshanartha Yavagu, Ushna Jalapana, Tambula Sevana. Some of the diet forms, diets or ahara that can induce this Rukshana. So millets, koda millets, barley, so all these things, whether it is honey, Tambula Sevana, Takrarishta, so all these things directly can deal with Rukshana, Madhu, so all these things are also in practice. And some of the Aushadhis or Aushadha Dravyas like Takrarishta, Pipali Prayoga, Trifala Prayoga, Gomutra, Pathya, Haritaki, Gugulu Prayoga, or it can be Tikatu also, Panchakolo also, and some of the Kashaya Pana like Amrutotram Kashayam. See, this Amrutotram Kashayam especially very widely practiced, Nagaradi Kashayam very widely practiced in the treatment of Amavata, Vatrakta. So wherever there is Amayukta condition, this is very, and it is also practiced, widely practiced in Jwara Chikitsa. Practically when seeing any Jwara, whether it is Sannipataja, Kapha Pradhana Jwara, it's a very beautiful prescription and it is definitely, it not only deals with Kapha but also the Ama Lakshana in the Sharira, the Ama Pradhana Jwara, all these things. So Kashaya Pana like Amrutotram Kashayam, Nagaradi, Trifala Kashayam, Chirovilvadi Kashayam, Panchanimba Kashaya, Nimbadi Kashayam, Lekhaniyagana Mahakashaya. So all these Kashayas, they induce Rukshana. See, these are all, they induce, they do, there are some of the Kashayas, they are Tikshna, Ushna, they have this Ruksha Guna Pradhana, they are Kashaya Rasa Pradhana, and they also induces Rukshata in the Sharira. So this can be, it has to be selected based on the Vyadhi, based on the Avastha individually. Some of the Ksharapana, even Ksharapana, Panyakshara, Ksharodaka, Arishta Prayoga like Takrarishta, Abhairishta, Asapa Prayoga, especially like Panchakola Gomutra Chitrakasavam. So all these things are widely practiced. Asava Prayoga, Arishta Prayoga, Prayoga in form of orally, that is Paniya Kshara. When this Kashaya Panas, that it is Takrarishta. So all these things are some of the uh, medicines or Kashayas or Arishtas. So we are practicing to induce this Rukshana. So yes, just I have just noted down the principles of some of the internal how we induce Langana. Yes, Rukshana Pana, Amapachaka Dravya, Takra Sevana, Yava, Kulatha, Mudga, Takra, Trifala, Musta, Chitraka, Vacha. So all these things can be administered internally in form of to induce this Rukshana. So coming to the Next slide. So even we can do churna prayoga. Churna prayoga like Triphala churna, Panchakola churna, Tikatu churna, Vaishwanara churna, Brad Vaishwanara churna, Ajmodadi churna, Shadharana churna, Ashta churna, Sudarshana churna. So churna prayoga also can be done for this Rukshana Karma as this churna do Ama Pachana Agni Dipana. So Pachana hi Rukshana. So many of the acharyas have also told this Pachana hi Rukshana. So similar type of karma, similar type of action, and this Churana Prayoga also can be done and that can be practiced in form of internal Prayoga. Phanta Kalpana, Panchakola Phanta, Sudarshana Phantam. So all these can be practiced. Gugulu Kalpana, especially Triphala Gugulu. Gugulu Prayoga also classics have highlighted. Our acharyas have highlighted the Gugulu Prayoga for this to induce Rukshana. Again, Panchakarma, so Ruksha Purvaka Snehapana. So yes, Ruksha Purvaka Snehapana, it already spoken. That is Mamsala Medra of certain condition. We have to give Rukshana fast, then Snehapana has to be started in certain diseases. Basti Karma. Basti is Ardha Chikitsa. Some of the acharyas also consider it as a Pradhana Chikitsa. And see in Basti, we can do any karma. So any karma you name, so that can be done. That's why it is Ardha Chikitsa. So they have told तत्र स्नेहादीनां कर्माणां बस्ति कर्म प्रधानं तमाहुर आचार्य कस्मात् अनेक कर्म कृत्वात् बस्ति. तो यह खलु बस्ति ही नानाविध द्रव्य संयोगात् दोषाणां संशोधनं संशमनं संग्राही करोति क्षीण शुक्रवाजी करोति कृशं ब्रह्मयति. So the question is that what you want. So what is the target? What is the disease? What is the condition? What is the avastha? You name and you can formulate a basti based on the ingredient, based on the vyadi, based on the doshas, you can prepare the basti and administer. Similarly, if the discussion or point of view is to induce the rukshana, the induce shodhana, so induce this lekhana karma, then there are specific basti, churna basti. We are practicing this churna basti with Vaishwanara churna. So Vaishwanara Churna, we are using this Churnavasti, 1 or 2, 3, sometimes 1, 2 or 3 Churnavastis for 2 to 3 days. This is also while starting off any treatment that we plan, 1 to 2 Churnavasti gives a better result initially and has to be practiced based on the Avastha. Shodhana Vasti is Vaitrana Vasti, again one of the very celebrated Basti in the treatment of Amavata. Kshara Vasti, Gomutra Vasti is Erandamuladi Kshara Vasti. Lekhana Vasti, especially with Ushagadi Gana, Triphala Kashaya, Lekhanya Gana Mahakashaya. So all these bastis are usually Tikshna, Ushna and Ruksha in nature. Even there is a practice Virechana Karma, broadly speaking, we can just divide into 2 times, Sneha Virechana and Ruksha Virechanas. So we very well know that there is Snigdha Virechana which comes with Gandravasta Dhiranda Taila, Nimbamrita Dhiranda Taila, Virgundi Aranda Taila. So then that is the part of Ruksha Virechana, the Snigdha Virechana. But talking about especially about Ruksha Virechana that induces Rukshata in the body, so we have some of the Churna yogas and Kashaya yogas. Patola Muladi Kashaya, Abhipattikara Churna, Haritaki Churna, Triphala Churna, Abhayadi Modak, Ichhavedi Rasa, Triphala Kashaya. So these are some of the Churna Kalpanas and Kashaya Kalpanas that can induce this Rukshata in the Sharira in form of this Shodhana, that is Virechana Karma. So if it is Snigdha Sharira, then we must do this Ruksha Virechana. If it is Ruksha Sharira, better to go with Snigdha Virechana, especially with Eranda Taila. So it is told very beautifully, Sarvesham Taila Jatanam Tila Taila Visasyate Balartha Snehana Chagre Eranda to Virechana. So again coming to this Rukshanasya, so very widely practiced, we have Avapida Gananasya, that is Swarasanasya, in form of Tulsi Shodhana variety of Nasya. Usually this Avapidana type of Nasya is a Shodhana variety of Nasya where we instill Swarasa into the nostril and different things we can practice in different ways like Tulsi Swarasa, Drona Swarasa, Dhruva Swarasa, Dhruva Swarasa. Again, we also practice Budanagra type of Nasya, especially in Pratishaya, Dushta Pratishaya. So these are all in practice. Shodhana variety of Nasya, even this Pradhamana Nasya, Mapna Nasya, Churna Nasya, Katphala Churna Nasya. Some also do this slight some trikatu, sometimes there is some congestions, so we also blow some of the Tikshna churnas, Ushna churnas into the nostril in form of this churnanasya, pradhavanasya, this dhumanasya also. In dhumanasya also we can use any Tikshna dhumas, any we can use Triphala, so we can use Agaru, so Haridra, and see Dhumanasya, talking about Dhumapana and Dhumanasya, we can select. If we want to make it Snigdha, it will, you have to just add the medicated ghee or go ghrita, then so it becomes Snigdhata. So if you have the Ruksha Dravyas, if you are using any Ruksha Dravyas, especially Ruksha Dravyas like this gugulu, if you are adding gugulu to that, if you are adding trikatu or some triphala, so then it becomes this tikshna. Or sometimes some people also add manashila, so thus things also become tikshna. This dhuma becomes tikshna, and need not to put this goghrita into this dhuma type of nasya, then it becomes ruksha dhuma nasya, ruksha dhumapana. Such varieties, as such way we can modulate, or such thing we can modify according to the condition. Karshana type of nasya, karshana nasya, that can be okay. Again coming to coming to some of the external method, that is bahya rukshana. So there are ruksha sweda, so very widely practiced all over India. So Ruksha Sankara Sweda, so Ruksha Pinda Sweda, that is Ruksha Pinda Sweda. So whenever we think about this Pinda Sweda, it will come in three ways. One is Ruksha Pinda, Snigdha Pinda, Ruksha Pinda Sweda, that is Snigdha Sankara, Ruksha Sankara, or Snigdha Ruksha Sankara, combination of both Ruksha and Snigdha. But as our topic is Rukshana here, I have just highlighted the Ruksha Pinda Sweda, especially Baluka Pinda Sweda, Ishtika Churna Pinda Sweda, Churna Pinda Sweda, Kola Kulathadi, Kotam Chukadi Churna, whether it is Triphala Churna, we have to select any Ruksha Churnas. So this comes under the purview of Ruksha Sankara. Then comes coming to Ruksha Parisheka, that is Drava variety of Sweda. So whether you do Avagaha or Parisheka, so comes under the purview of Drava Sweda, and the medicine should be Tikshna Ushna Dravya, especially like Dhanya Amla Dhara, Dhanya Amla, or it can be any Kashaya, Kashaya Parisheka, especially like Triphala Kashaya, Takra Dhara, Gomutra Dhara, Kashaya Dhara, Ruksha Kashaya Dhara, Dhanya Amla, Aranala, Kanji. So such medicines should be used to induce Ruksha Dhara. So such are the some of the Ruksha Parisheka Sweda. So coming to Ruksha Dravya Bagaha, same thing, Triphala Kashaya, Dhanya Amla, Gomutra can be used. Gomutra Arka, Gomutra directly can be used also, and Gomutra Arka. We can use Gomutra Arka and dilute with some Ushna Jala, or Gomutra Arka can be diluted with some Kashaya like Triphala Kashaya or Erenda Muladi Kashaya or Dashamuladi Kashaya. It can be formulated in such way while doing Parisheka and Avagaha under the purview of Dravasveda. Then Rukshana Upanaha. So Ruksha Upanaha Sveda. Again, very beautiful formulation, this Upanaha. See, in Upanaha, we have few principles. There is a base churna. Whether you use rice powder or you use atta, so anything. So Sali churna, so Goduma churna. So one of the base churna has to be kept in the mind initially. Then you start adding some of the Ushna Dravyas, whether you put Devadaru, or you put Bacha, or you put Rasna, or you put any Tikshna Dravyas. So depending upon the condition, whether it is Pittahara. Again, we have to add a Drava Dravya, especially Amla Dravya, like Takra or Aranala or Kanji or Nimbukaswarasa. So a Drava Dravya has to be used. But while formulating the Ruksha Upanaha, oil or Sneha Dravya need not be used. So we should not use any Sneha Dravya, whether it is Ghrita, Taila, Vasa, Majja. No Sneha Dravya should be used in this Ruksha Upanaha. As the name, it is Ruksha Upanaha. So we have to formulate it like that, and all the principles are same, and we should put Ruksha Dravyas, Ruksha Churna is especially, but Amla Dravya has to be put, but it should be devoid of Sneha Dravya or Mamsarasa or any Snigdha Dravya or any Snigdha Ushadis. Those should be avoided while formulating the Ruksha Upanaha Sveda. Principle has to be like that. Coming to Udvartanam, so very well know that Udvartanam Kafaharam Metasi Pravijayanam Sthirikaranam Angana Tvak Prasadakaram Param. So Udvartana again Udgharshana. So the again the pressure is more Pratilomagati direction, and the medicines used here are Triphala Churna, Kolakulata Churna, Kotamchukati Churna, Kulata Churna. See all this medicine you see it will be Katu, Tikta, Kashaya, Ushna, Ruksha. So these are the principles, but it goes inside into the treatment aspects. Again, Luksha lepa can be advised. So, Ajmodadi churna lepa, Kutumchukadi churna lepa, Nagradi churna lepa. So, widely practiced. Shatapushpadi lepa, Agni chikitsa lepa. So, we have 5 wet drug and 5 dry drugs. Again, Parpataka, Bandha, Panatulashi. Then there are dry dry, especially like maricha, lasuna. So such things we make a combination of this strain drug. We make a paste, give a little to administer internally, and the rest all are externally applied. Widely practiced in one of the institute in Karnataka, especially in SDM Udupi. So widely practiced Agni Chikitsa Lepa is nothing but a Rukshana Chikitsa. So that becomes the initial line of treatment in many of the arm pradhana vikaras or any of the diseases wherever there is arma. Again, the yoni prakshalanam. See, if the medicines we are using are like ruksha pradhana dravya, especially like triphala kashaya, then it will also become this yoni prakshalana also will do rukshana. Yoni dhupana, again this dhupana dravya has to be Ushna, Tikshna, Ruksha. Karana dhupana, lekhana anjana, lekhana putapaka, Ruksha Tallam, Talapodichil, Kavala Gandusha with Ruksha Drabyas, Trifala Kashaya, Dhanya Amla, Gomutra, Tatra, and any Kashaya also. And Aranala, Kanji, so thing also can be used and we should avoid this Sneha Drabya while doing this Kavala Gandusha, and it should be like Ruksha Drabyas in this manner. Dhumapana, especially Varechinika, Rechana, Shodhana, Tikshna Dhumapana, drugs like Haratala, Manashila, Agaru, Laksha, Apamarga, Trifala, etc. can be used. Gugulu, such thing has to be used in the Dhumapana. Dhumanasya, if we want Rukshana effect, we can think about this. There is congestion, there is Dushta Pratishaya, upper respiratory tract allergic and reoccurring many times over the years, then definitely uh, need not go for we can plan any Tikshna Nasya with Guda Nagar Nasya, but better than that, can think differently by giving any Ushna Tikshna Dhumapana with the Ruksha Dravyas. And there is a running nose also severely, 3 to 4 months of running nose, and it is not mitigating, then just we can just think differently by giving this Tikshna Ushna, this Ruksha Dhumapana Dhumanasya. And coming to some of the Bihara, so Nitya Madhyapana, so regular intake of alcohol also will induce Rukshana in the body. Vyayama, Atapa Sevana, sunbathing, Vyavaya. So excessive sexual intercourse also will lead to Vata Prakopa, and eventually this Ruksha Guna will increase in the Sharira. Chinta, mental stress, Shoka, Ushna Jalapana, regular intake of warm water, hot water. These are some of the Bihara that will induce Rukshana in the body. So Rukshana in daily practice, Vyayama, Ati Vyayama, Udvartana, Tambula Sevana, and Dhumapana. So coming to the application of Rukshana in clinical practice. So Rukshana can be practiced in these 3 forms, can be practiced in these 3 protocols. So Rukshana as a preparatory procedure or Purvakarma, and Rukshana can also be practiced Rukshana as a prophylaxis and management of post-operative complication of Sneha, that is Sneha Vyapat. So in Sneha Vyapat also, Rukshana becomes a main line of treatment in managing all these complications arising out of this Ati Snehapana or any Sneha Vyapat. And third one, Rukshana as a main or standalone or first line of treatment Pradhana Chikitsa in very specific diseases, especially I have highlighted the diseases like Spaulia, Urustamba, Amvata. So this here becomes a pradhana where there is ANA positive, CRP positive, RA factor raised, ESR raised, CRP raised, so anti-CCP positive, ANA positive. So these are some of the markers, the inflammatory markers in some of the diseases where we start with initially with the Rukshana line of treatment, whether it is rheumatoid arthritis or whether it is SLE. Treatment has to be started in this Rukshana initially, or can become a main or standalone treatment. So Rukshana as a preparatory procedure or Purva Karma. So Rukshana Purvaka Snehana or Rukshana as a Visishta Purva Karma before administration of Shodhananga Snehapana, because it prevents Sneha Vyapat. Very beautifully said. Mamsala Medura Bhurishleshmo Vishama Agni Sneha Chitascha Ye Sneha. So Sneha Purvak Rukshayat. So we have to, any patient comes with these symptoms, Mamsala, Medura, Bhurishleshma, Vishamagni, Snehaschita. We must plan initially with Rukshana for few days. Then after few days of Rukshana, once the patient attain the Samyak Ruksha Lakshana or Jirnahara Lakshanas or Nirama Lakshanas, then we must start with the Snehapana before planning any Vamana or Direchana Karma. So that has to be kept in the mind. So Mamsala, so again Upachita Mamsa, so bulky muscles, Medura, Medasvina, fatty obese, excessive fat, Bhurishleshma, excess of increased Kapha dosha, that is aggravated form of Kapha dosha, Vichmagni, altered state or irregularity of this Jatra Agni. So that has to be kept in mind. Sneha Chitascha, who is already taking Sneha years and years, has to undergo some of the Rukshana in order to have better absorption of the Sneha Pana. Sneha medicine can betterly absorb if we give this Rukshana. It is similarly like if there are two wooden sticks, and one stick you are drying are on the roof under the sunlight, and the next day you are dipping in the sneha, it absorbs more oil compared to a stick that is kept in the room and I am directly dipping it on the air. Means once the stick is dried properly under the sunlight, that becomes ruksha, and so that it absorbs the sneha more faster or rapidly. So that's how it works in the body also. The same mechanism, the same principle is kept while treating the disease also. When the disease is planned, either either in the OPD you have to plan like this: what should I do, whether I should give Rukshana or I should start with Snehana. So we have to examine, so we have to take a decision. If the call is about doing Rukshana, then how many days I have to do Rukshana and how to switch it to Snehana. So again you have to, because avasthanuchara chikitsa is not that I will do Rukshana means I will continue with Rukshana for 10 days, 15 days. It's not like that. Initially 1 day, 2 days, 3 days, 4 days you did Rukshana. Once you find a certain target, find a certain condition, then switch it to Snehana chikitsa. So that's how it is planned, this Rukshana Chikitsa. And yes, Rukshana should be done before the administration of Sneha. If it is not performed, then it results in Sneha Vyapat. In Sneha Satmya condition, if Sneha Pana is administered, then there will be Anutkleshana of doshas. Here Pachana is indicated, nothing but Rukshana. So again, it is very well said by many acharyas, Pachana hi Rukshana. So Rukshana as a prophylaxis and management of post-operative complication or Sneha Vyapat. So it is very widely, very beautifully explained in the shlokas of Sneha Vyapat and Chikitsa. So Tandrasa Utklesha Anaha Jwara Sambos Bisangyata Kushtani Kandu Pandutva Chofa Arsamcha Aruchi Trishna Chataram Brahani Dosha Staimitya Vakya Nigraha Shula Ama Pradoshascha Jayante Sneha Vibramat तत्र उल्लेखनं सस्तं स्वेद काल प्रतिक्षणं प्रति व्याधिबलं बुद्ध्वा श्रमसनं मेवच. तक्रारिष्ट प्रयोगश्च वृक्षपान अन्न सेवनम मूत्राणां त्रिफलास्य so त्रिफलायश्च स्नेह व्यापत अति भेषजा. So again, so coming to some of the immediate complication of Sneha Vyapat and some of the late complications and the chikitsa, the chikitsa highlighted. So because Rukshana forms here a prophylaxis type of treatment in this Sneha Vyapat condition. So what is the chikitsa? It is Ullekana. Ullekata is nothing but Vamana, Svedana, Sramsana, go with Virechana, Takrarishta, Ruksha Anna Sevana, Gomutra, Trifala Prayoga. Rukshana therapy is highly beneficial in Sneha Atyoga Janya Vyapat, and Rukshana therapy can be administered in form of Pana, Arna, and Bheshaja. Management, Takrarishta Prayoga, Mutra Prayoga, Gomutra Prayoga. Again, Takrarishta Prayoga, Tatra Prayoga can be done. Gomutra Prayoga, see nowadays, practically speaking, we can also use this Gomutra Arka, that is distillate of Gomutra can be diluted twice, thrice, 4 times. We can dilute it and we can use it properly, and we can check whether the patient is having this pitta pradhana things and all. We have to check because again gomutra if you are administering means we have to see the prakriti vikriti, whether the patient is suffering from any pitta as a condition, then we have to be careful and we have to think about, we have to dilute that with the times of 2 times, 3 times, 4 times. So based on the patient or kapha pradhana, then can we have less dilution in that. So we are administering this in empty stomach, and that can be planned for a few number of days. Pachana dravyas, yes, Pachana Dipana dravya, whether it is Chitrakadivati, any Panchakola Phanda, Panchakola Churna, Vaishwanara Churna, those discussions are over. So those things also can be used. Rukshana Sevana, so that can be there. Yava where we are using Kulatha. So those things we can also practice. Takra we are using Trifala Prayoga, Trifala in form of Churna, Trifala in form of Kashaya. So those things also can be planned, or Trifala in form of Dhumapana, such things also can be planned. Trifala Basti can be used, Trifala Dibasti. Trifala in form of this Churna Basti can be also used. Trifala in form of this Nirva Basti, Trifala Kashaya or Kalka we can keep as a Trifala. So those also can be practiced and formulated according to the condition specific. So Rukshana as the main or standalone treatment. So again, so coming to standalone treatment, so Rukshana becomes a prime line of treatment, primordial or a main treatment in conditions like Medabrita Vata, Urustama Vata Vyadhi, so Mamsa Medogata Vata, Mamsala, Medura, Santarpana Janya Vikara, directly indicated in diseases like Amavata, Staulya, Kavhavrita Vata, Avarana Janya Vata Vyadhi Samprapti. This can be used. Vata Kapha Chakradrasi. So Vata Kapha Chakradrasi also. So we can use this Rukshana. So Medava Srota Vikara, Meda Vikara, Kapha Medoza Vikara, Kleda Pradhana Vikara, because this Rukshana does Shoshana of Kleda. So any type of Kleda Pradhana Vikara also, this Rukshana can be administered. So this becomes the main line of treatment in the Vyadhi. So his standalone treatment. So Rukshana in Amvata, yes, in Amvata we are practicing. There is a very famous quotation. Langhanam Swedram Tiktam, Deepanani Katunicha, Virechanam Snehapanascha, Bastischa Amamarute, Saidavadi Anuvasascha, Ksharavasti Prasasyate. Whether it is Vaitranavasti, Ksharavasti, Valuka Pindasveda, Churna Pindasveda, Dhanyamla Dhara, intake of Vaishwanara Churna, Ajmudadi Churna, so Shadharana Churna, Ashta Churna, so such thing can be practiced and it is in practice. Seeing the Ama Lakshana, and we have to continue till the attainment of Nirama Lakshana. If Nirama attended and the inflammatory markers goes down, RA negative, all these things comes down, again we can switch to this Snehana Chikitsa in the later phase, in the second phase of treatment. Staulya Chikitsa, again Staulya Chikitsa we can do Udvartana, we can use Lekhana Basti, we can use Ruksha Virechana. So those things can be used. Gugulu Prayoga, Trifala Prayoga. So that can be Takrarishta Prayoga, Takra Prayoga. Rukshana will be done. So again, same thing. So application of Rukshana with some minimal mode of action I have just mentioned. Amavata I have highlighted properly. Again, Rukshana importance in Shodhana, those things also I had highlighted during the Bapads while explaining Bapad. Rukshana Virechana, Ruksha Virechana also I had highlighted. Yes, Ruksha Virechana, one thing I told that. So Ruksha Virechana is done using this Ruksha Guna Pradhana Drabyas, whether you are using Avipattikara Churna or you are using Triphala Kashaya, Triphala Churna, or you are using Ichhavedi Rasa, Ajmodadi Churna. So we have to select, and Ruksha Virechana is selected in Snigdha Sharira. So that can be done slowly also. We can practice the Ruksha Virechana, hypothyroidism, Stula Pramehi, Mamsa Medaja Vikara, this Mamsala Medura hypothyroidism, PCOD patients, patient with PCOD, PCOS, hypothyroidism, Stula Pramehi. So the dyslipidemia, hyperlipidemia, such condition also we can go with this Ruksha Virechana with Ruksha Ushadis. Ruksha Vasti, again, this comes with Baitarana Vasti, Gomutra Vasti, Kshara Vasti, whether it is Lekhana Vasti. So same thing. You only the principle is that you have to use Ushna, Tikshna, Ruksha Drabyas, Ruksha Drabyas, Ushna Drabyas, Tikshna Drabyas. So has to be used properly. So this thing. So Avastha Anusar, again you have to see the cannot be practiced in the blind eyes. We have to examine the signs, symptoms. We have to see the lab investigations, the markers. Some of the markers in autoimmune disease goes high. So such thing has to be correlated by clinical examination, also by the some of the lab investigation. You are sure that there are Dama Lakshanas. We need some of the weight loss, or we need Shodhana Karma, we want Rukshana Karma, we want Lekhana Karma, then just go ahead with this Rukshavasti. Need not be a Rukshavasti, somebody wants Rukshavasti. It's not like that you have to plan for 8 days, 6 days. Just one or two Rukshavastis are also enough in many of the condition. So then you switch over to another variety of basti. So such thing can be done. So for example, if we practice initially we do chodhana, then we can start with, for example, Dashamula Kshara type of basti in clinical practice. Then just switch to this normal Dashamula basti. Then you can also do Brahmana by Dashamula Kshira basti. So such modification you do Shodhana, then we do some of the Brahmana, then treatment has to be completed in such way. It's not that we did Rukshana, we do Chodhana and we have just left the patient. So has to be done Avastha Anusara. You do Rukshana, the Rukshana Karma is done, then we do Snehana. Once we do the Vata Shamana in form of Sneha, then just plan for any Brahmana Karma. We can plan this Brahmana Basti, Rasayana Basti. So such mentality has to be developed by practicing this Basti. We can also practice Churna Basti also come under this purview. Churna Basti, Vaitrana Basti, Ruksha Basti, Kshara Basti. So such planning has to be done. Again, this is some of the very widely practiced basti in the treatment of Amavata. This is again Vaitrana Basti, different. See this Vaitrana Basti. Once you see the reference Chakradatta, Vrindavadama, Vangasena, so broadly it will come under these two types. One is Gomutra Yukta Vaitrana, another one is Godugdha Yukta Vaitrana Basti. And the commentary says it is Isha Taila Yutoyam, Isha Taila Yutoyam. That's about Taila. Practically can use Tila Taila, that is Murchita Tila Taila. So few practitioners they also use Saindhavadi Taila, Bruhat Saindhavadi Taila, Kutumchugadi Taila, that can be practiced. And so Guna, again, Purana Guna should be used. Amlika, the paste of tamarind that is devoid of these parts. So the paste, the creamy paste of this Amlika it has to be dipped in the water, hot water. The next day we have to squeeze it, and fibrous parts, seeds has to be removed, and it is only the paste has to be kept. Gomutra, again, Gomutra. If we are putting, then Gomutra practiced directly, you have to put Gomutra means, so there are two practice. One is Gomutra Arka, another one is Gomutra. So few of the old practitioners in Kerala also, in Maharashtra also, they put directly Gomutra, but that Gomutra should be from a cow who is not suffering from bovine infection. So, and it has to be collected immediately from the urinated place through a good container and has to be immediately put, mixed and administered. And again, there are nowadays for safety purpose, practitioners they use this gomutra arka. Gomutra arka is nothing but the distillate, the potentiate form of gomutra, which is bit distillate. It's a pure form, and it has to. You can just put it better. Not to use it only gomutra arka. It can be diluted with any kashaya. For example, basti if you put Akshika Lavana Sneha Kalka, and Kwatha if you are putting Kashaya you put, and we put 50 to 60 or 70, 80, 90 ml of Gomutra Arka, and that itself get dilutes with the other ingredient of Basti, especially this quantity of Kashaya is more, that dilutes that. And Gomutra, Godudayuka Vaitrana, again it is practiced more in this Kapha Vataja Gridlasi. So Ksharavasti, you can see the quantity, so both are different, Ksharavasti and Vaitranavasti, but the quantity of, you can see the, it is more, bit more, the quantity is bit more compared to this Vaitranavasti. Guda is 4 times to the Guda mentioned in Vaitranavasti, and the Samlika is twice as compared to this Amlika in Vaitranavasti, and Gomutra is also twice. So that signifies that this slide signifies that Ksharavasti is bit more Tikshna, Ushna, and more potentiate as the ingredients are more, the quantity is more. So that tells about the Ksharya nature is more in as compared to this Vaitran type of Basti. So Ksharavasti mentioned in Chakradatta and Vangasena. Vaitranavasti is also mentioned in Chakradatta. Coming to the indications of Vaitranavasti, see, it is very Shulaharavasti, Anaharavasti, Amaharavasti, Amavataharavasti, and Vangasena that has told about Godukta Vitrana, Amanila, Amavata, Shula, Gridrasi, Vata Kafaja Gridrasi. So those are in practice. Again, I was telling about this Purana Amlika has to be used, which are Ksharya nature. Sorry, Purana Guda, Pakwa Amlika, ripened one, Saindavalabana, Gomutra, Ilataila, Mochita Tilataila, those has to be used in Vaitranavasti ingredients. Dasya also we can use. I also told you that like the use of Avapidana Nasya, Swarasa type of Nasya, Guda Adraka Nasya, Churna Nasya, Ruksha Dhuma Nasya. So those are also in practice. So discussion. Ruksha Drabyas have the qualities such as Ruksha, Laghu, Tikshna, Ushna, Sthira, Apicchila, Kathina. One among each quality has its own importance in the treatment. Rukshana does Shoshana, Lekhana, Agnidipana, Shodhana. So Udvartana acts as Rukshana in case of Ama, Meda, Afaja condition. Paricheka acts as a Rukshana in case of stiffness. Takrapana, one of the best internal Rukshana in case of Stolya. Again, so Shadvidhopakrama can be planned accordingly, and Rukshana is one among Shadvidhopakrama, Dvividhopakrama, and this is especially this Sneha Bhava Drabya, and Rukshana can be performed as a Purva Karma also, Pradhana Karma also. So Lekhaniya Mahakashaya acts as Rukshana, Lekhaniya and Mahakashayas can be considered here due to the similarity in the quality of Lekhana and Ruksha Drabyas. So this is all about the Rukshana, the principle and practice. So thank you one and all.
Thank you so much, Dr. Dibya. It was a very, very nice presentation, including so many things about Rukshana. Even if I didn't know that so many points are there in Rukshana actually. So thank you very much. Now we will go to Q&A session. So I will request our participants if they have any doubt or anything to ask to our guest speaker, they can put the questions in Q&A section, Q&A box, so we can discuss here in the next session. So till then, I think Dr. Sheenas, I will invite Dr. Sheenas for the question and answer session. And one question is from my side, Dr. Dibya. You said about that ahar kalpanas are there, which can be, which we can give for Rukshana. So many people like ragi and that kodo, millets, and all those things were included in ahara. But usually people try to prepare that ragi and kodo by using sugar or guda. So, can you share some recipes? How we can prepare these things so we can take it, because it will be taken in regular basis. I think we can take it if we need Rukshana Karma for our body. So, how to prepare? If you can share some recipes, it will be beneficial.
Yeah, practically speaking, in the era of lifestyle disorders, there are see people who were eating many rice items in the past. The people were eating atta, so there were the diabetic patients. People told that we will avoid rice. We'll take this atta into our diet. Then the principle came that it is gluten. The atta is especially gluten. Then people stopped taking this atta type of thing. Then consumed very little quantity of rice. Then the theory comes with these millets. The millets are the food of poor peoples. So the India are the producer of millets, ragi, so such things they produce, and people were just neglecting those things, thinking that is the food for. But nowadays there is high demand of these foods prepared from ragi. So ragi dosha, whether there is malt prepared of this ragi, and we can put bit of trikatu, shunthi, maricha, pipali, or we can put like this of chunk, tadka with this hing. So such thing can be made, and foxtail millets, kulatha, foxtail millet, and kulatha soup, kulatha dal, and we have to give this tadka and chung. So see, the nowadays also the ma'am, those the government is coming with this Patya Kalpana, this Swasthavrutta department, the India wide, the colleges they just prepared lot of recipes out of this millets, ragi. So means it is beyond that, people comes with different startups, different ideas, and same thing what we are doing, we are just instead of this dal and other things, moong and all, we are just putting this foxtail millets and all ragi. So lots happening, and why not to consider in the lifestyle diseases, especially this Santarpana Janya Vikara. This is a era of lifestyle disorder. I think that Snehana we are practicing. People are all aware of Snehana, but nobody. Rukshara is a underrated thing, and it has to be Rukshana coming over Snehana. So because the world is a the this is a era of lifestyle disorder. This is the era of Santarpana Janya Vikara. So why not Rukshana? So Rukshana has to be perfect, means has to be practiced in all forms. So Rukshana should become a main line of treatment. I should compliment Rukshana for that. And as you mentioned, it has to be practiced in this Ahara, and Ahara will definitely play a main role in this format.
Yes, yes, of course. So basically, that preparations and as the sir said, you can add trikatu, you can add plain. So it will, but do not add sugar or guda. I think so. People usually make halwa out of ragi halwa and millet halwa. So halwa is not recommendable for I think rukshan karma.
Yeah.
You can use sandavlavan, trikatu, and these things, and you can boil it like
Yes.
halwa, and you can take it. So I will invite questions from our participants, so they can put their questions in
One
Q&A
question I think
session.
came, ma'am, from there. One
हाँ,
question from
so
Dr.
Dr.
Praveen
Srinath will
Mugle, sir.
carry out this question answer session.
Okay, ma'am,
Dr.
thank
Srinath.
you. One question from Dr. Praveen, sir, actually, how Rukshana principle will be beneficial in terms of Shalakya Vigaras like Abhishanda and Adimanta?
Yes. Yeah, I see. So I will give certain example. I can quote certain examples. See, if we come across running nose, so running nose, pratishaya, dushta pratishaya. So these things, that means there is some of the ama lakshanas. So running nose happening means we should confirm that there is a bit of ama, and we can use this rukshana. I also mentioned dhumapana. Dhumapana means inhalation of dhuma through mouth and exhalation through mouth. Dhumanasya, you inhale it and just exhale it through the mouth. So with Ushna dravyas, as I mentioned, agaru, hartala, manashila, gugulu, agaru. So such things can be used. And Rukshana can be done in this Pratishaya. If I quote this ENT disease, especially related to Shalakitanta Dushka Pratishaya. See, I mentioned Gudadraka Nasya also. Gudadraka Nasya. So Gudadraka Nasya is a very beautiful Nasya, and even that also becomes Rukshana. Gudadraka Nasya is a Rukshanasya, Ruksha Vapidana Nasya that can be used. Again, Churna Nasya, few practitioners, they use uh, Choshat people sometimes very little quantity in the pipe they will blow. There will be a small pipe straw type of things, and then slightly they start blowing very little quantity of uh, either trichotu or this pipali Gaja people be bit late and they will start blowing to that, and there will be reddish type of face, so much secretions, your eyes will become red, there will be secretions coming out from the mouth, nose, from all the channels. Then that's how the shodhan means bit shodhan we get. Gargling with this triphala type of kashaya, trikatu kashaya, this Ushna Tikshna drabyas, that also can be considered related to this year. And so again, see, in people suffer from these red eyes and all, conjunctivitis and all. See, there is eye washing with this triphala of eye wash. So again, that there also we are using this ruksha drabyas and all.
Okay, thank you, sir. Actually, one more question came actually that already discussed. I think Purana Guda and Purana Madhu may have Rukshana properties. Question, right? But
Definitely, Purana Guda is Sharia in nature and it has more Rukshana, Navaguda Brahmana in nature. That's how it goes in. And Madhu, see, Madhu very practically explaining that the honey we get from market is Brahmaniya because there is a dilution with sugar, syrups, and we even don't know whether it is origin. It is not Kapha Khara, it is Kapha Khara rather than Kapha Hara, the honey we get from market. But the original honey that we get from forest, procured from forest areas, the traditional honey that is brought from the jungle area, forest areas, those are even mentioned in Anupana in Prameha Uchadis, Madhumeha Uchadis. They are Anupana because honey is Kafahara in nature. So we have to select, we have to be wise enough to select the original variety of honey. So if we are planning a Lekhaniya Vasti and we are putting again the sugar syrup type of honey, putting then just expect Brahmana and don't expect any Kafagna action means in that. When such wise formulation has to be done. So in my while I was in PG, so I had in PG and PhD also my thesis are on Basti. I very wisely select the honey because that procuring honey will have this medicinal effect, part effect we want this. In Basti it has to be Kapara effect. That is the rationale and that is the relevance.
okay, thank you, sir. Actually, one more question is there actually from Nandini. Rukshana as indicated in form of Udvartana in Staula, also about that Utkarshana also in Staula is mentioned. She is asking how to decide whether to go for Udvartana or Utkarshana, like that is asking. So, what is the difference between both?
So comparison when it comes to Udvartana, Udgharshana, Utsadana, difference is very less, I can tell you. So Udvartana, Udgharshana and Utsadana. So Udvartana is powder. We are rubbing powder massage. We are rubbing the powder, whether it is Triphala, Kola, Kulathadi, Potom Chukadi. We are rubbing. Pressure is like medium. Means we can give medium pressure, high pressure depending upon the patient, depending upon the obese the patient is. But when it comes to Utsadana, we have to mix some oil. Some oil has to be. It is Utsadana is told for beautification purpose more. So oil is added to the churnas and it is rubbed. It will give both effects. Some Snehana effect will come, some Rukshana effect will come with the Ushadana as oil is added in that. And when it comes to Udgharshana, the pressure applied is more compared to Udvartana. What I understood that it is Pratiloma Gati, the force is applied and the pressure is more. In Udgharshana, the force is more and you can see the ucharana of that udvartana, udgharshana. That gharshana means friction, and the udvartana pronunciation and udgharshana itself says that gharshana or the is somehow more compared to the general udvartana what we practice. So that's a very simple difference between udvartana and udgharshana. And utsadana means oil we are adding, and the main purpose is about beautification. Utsadana.
Thank you so much, sir. I think anyone have any doubt, you can put your questions in the chat box. You can wait for 2-3 minutes. If anyone have any doubts, please put in the chat box. I think everyone's doubt is clear, I think. No. Ma'am, can wind up, ma'am? Go to vote of thanks then.
Sir has actually vividly described each and every point, so I don't think anywhere doubt is for
They
doubt
are in
no
the
space
level
is
of
there.
Shiva and
So I
शिष्या तो
think
चिन्ना समस्या level में है क्या
very nice presentation. So we can
Actually,
wind up now.
okay, ma'am, then can go for it. Okay, thank you so much, sir, for that today's wonderful section. On behalf of Sri Babu Singh Jai Singh Ayurveda Medical College and the complete Prabodhini organizing team and Department of Panchakarma from Sri Babu Singh Jai Singh Department College, we give the big thanks to Dr. Dibyajyoti sir, actually given a very good description about the Rukshana therapy from the starting to end, because all the Panchakarma is covered, the diet pattern, whatever the things are explained in the Rukshana and the Panchakarma and Ayurveda, almost I think covered in this presentation. It's a very nice presentation. Thank you so much for your valuable knowledge and time, sir. And I would like to thank our respected Chairman Sir Dr. Shailendra Singh Yadav sir and Dr. Sunita Yadav ma'am for giving that moderate all over the support for this Prabodhini webinar series. Thank you so much, sir and ma'am. And I would like to thank Dr. Manjunath and our respected principal sir, and Dr. Rambabu sir, our vice principal, for the continuous support and promotion of this program. And next, I would like to thank our department, the Panchakarma department, Dr. Vishwanath Mishra sir, Dr. Professor, and Dr. Ningama ma'am, Professor, and Dr. Sulfiat ma'am, and myself, Dr. Shinas. And also go to our organizing committee. Dr. Preeti ma'am already described. Actually, Preeti ma'am and Nihal sir is continuously giving that valuable support for this program. Actually, if I am forgot also, they will remind to that start the program again. Also, thank you so much, sir and ma'am, for this valuable support. And so also I will like to thank all the teaching faculties in Sri Babu Singh Jai Singh Ayurveda College. They are also giving much more support for this program continuously, because we are planning every month department wise we are planning. So every department give that valuable support for that. We are arranging very best speakers all over the national wide speakers we are taking, so that all the departments or head also, all the teachers also supporting very much for this. And very main and important part is the delegates, because very happy news actually last, because of some hectic schedule or some programs, actually we didn't conduct that webinar in 1 or 2 months last. Actually, in that time, actually continuously many call came from many places, especially from in UP only. Actually, one senior person is also calling for that. When you are going to conduct that program, we are waiting for that. So that enthusiasm actually giving much more support for us for the continuous arrangement of this program. So thank you so much, all the delegates who are participated here, and thank you one and all. So we can wind up the session with the.
So I just
Yes.
want to thank the core organizers, the Srinath sir, Nihar sir, Pritimay ma'am, the core organizers for giving me opportunity to present before all of you. And I must thank the management, Sri Babu Singh Jai Singh, PG Ayurveda Medical College. I thank the entire department of Panchakarma, the professor, HOD, associate professor, assistant professor, all of them. And I also thank the management people and all of you. Just I thank the delegates, those who were present in this webinar. And thank you one and all. And so I was very happy to present here. Had a very wonderful knowledge session because for doctors, for we Vaidyas, sharing knowledge gives us more happiness rather than anything. And I am thankful for the opportunity given by this institute, department, and the core committee members. Thank you one and all. Thank you, sir.
Thank you so much, sir. Actually, okay. We are also very grateful to get you for this today's session. Thank you so much, sir, again. And anyway, we will continue this the Prabodhini series coming days, also coming months, also. So hope everyone stay tuned with us. Okay, thank you so much. We can wind up the section with the national anthem.
Yes.
Thank you so much, Dr. Srinas, and thank you to all the participants for being present till the end and enjoying this session. And Jai Hind, Jai Bharat. And you all will be getting your recertificates within 7 working days. So please be patient and wait. And we are also wait for our next notification for our Prabodhini webinar series next Parva. So till then, be happy, stay healthy, and namaskaram to all.